is Dr. Sahar Khamis. Welcome to my program, The Bridge, a monthly show bridging different cultures, communities, and faith traditions. Watch The Bridge on America's Voice of the Arabs Network on all social media platforms. Good morning, everyone, and welcome to another episode on the program The Bridge, coming to you live on Facebook and on US Arab Radio. Today, we're talking about the American Muslim community, the most important contributions and numerous challenges of this particular community, what they're facing and what they're contributing to American society. And with me this morning discussing this important and timely topic is an expert on this particular area of research, Ms. Petra Alsoofy, who is the Outreach and Partnership Manager in ISPU, the Institute for Social Policy and Understanding. She has been managing the ISPU Scholars Network and working also in public education and interfaith work for the last 15 years. She is a researcher and she is a writer and an interfaith activist. Welcome to the show, Petra.
Thank you so much for having me, Dr. Khamis. It's a pleasure to be with you this morning.
Thank you so much for accepting the invitation and joining us today for this interesting and lively discussion. So let's start first by giving our audiences everywhere a brief idea about ISPU, its role, its mission, and vision.
Yes, so the Institute for Social Policy and Understanding, ISPU, we're an applied research institute. What we do is we conduct and share objective research on American Muslims. We have been around for about 20 years. We're entering our 20th anniversary, founded in Dearborn, Michigan, after 9/11. And our focus is solely on American Muslims domestically here in the US, issues related to them, issues related to building the capacity of the American Muslim community internally, but also issues related to American pluralism in general. So what you will find at ISPU is research that's related to American institutions, American Muslim institutions, American Muslim issues, and American pluralism. And our goal or our mission is to try to provide objective research. So we identify a problem and we provide objective solutions to the problem or recommended solutions to the problem. And our goal is that dialogues and decision-making about American Muslims will be informed by research. And so whether it's by Muslim Americans or non-Muslim Americans, we want every decision on American Muslims to be informed by research. And finally, our focus is, or our goal is that we want to see in America where American Muslims are thriving and equal. So that's a little bit about us. I'm happy to share more about our research.
Absolutely. When you talk about this concept of American pluralism, maybe we need to just unpack it or explain it a little bit to our audiences who may not be necessarily familiar with this particular concept. What is exactly meant by the term or the concept of American pluralism?
Yeah, so when people think about issues related to American Muslims, they think, just American Muslims, and they don't see how it fits in the larger context of the society we live in. We live in a democratic society where the rights of minorities, which American Muslims are a minority, we're only 1% of the population, are protected constitutionally, and religious liberty and the religious issues are protected or were part of the reason this country was founded on. So those issues and issues that we see in mainstream media that are being discussed, religious liberty, minority issues, things like that, are related in at the core of what makes American Muslim, community and how it fits in within the larger society. And then the other part of it is a society where people of all walks of life, whether we're talking about religious beliefs or, ways of lives or ethnic backgrounds, or it's a society where it doesn't matter who you are or where you came from, you are ruled by the same rules and laws, and at the same time your rights are protected. So that's part of it. And then the last piece from our perspective is, issues that impact American Muslims. They don't only impact American Muslims, they could actually impact American democracy and American pluralism. So that's the connection here.
Right. American Muslims are part and parcel of society as a whole. They are not separated or isolated from the rest of the American society, and therefore whatever impacts them is also in a way or another impacting the rest of society and vice versa.
Absolutely. And sorry to just add one thing very quickly. And American Muslims are not new to this nation. They have been part of this nation since its founding. A matter of fact, the largest segment of American Muslim community is the African American community, which we know has been here, since its foundation. And so American Islam is not new. It was not brought with the immigrant community. It was founded with the foundation of this nation.
Absolutely. I think this is a very important point because some people have the misconception or the misperception, and we're going to be talking about misperceptions and misconceptions later on in this discussion. They think that, American Muslims are all immigrants and they just came to the US yesterday. Well, guess what? This is not true. Just like you mentioned now, many of them came from the very, very beginning of this country and are part of the foundations of American society. This is a very important correction to make. I did see on ISPU's website also that you define yourself as an organization, which is actually based on, as you said, objective research to inform dialogue, well-informed dialogue and decision-making on issues related to American Muslims. This particular statement or phrase really attracted my attention. So I want to just shed light a little bit on this particular phrase. When you say objective research to inform dialogue or well-informed dialogue and decision-making on American Muslims, can you unpack this particular part of your mission and vision at ISPU to our viewers and listeners everywhere, please?
Yeah, so for listeners who are, for your listeners who remember 20 years ago, we didn't have a lot of people who were experts or who spoke expertly about American Muslim community. We had those who were doctors or teachers who just happened to be Muslim who were being asked, can you unpack your faith? Can you explain your faith? Can you, we were kids. I remember growing up, I was in middle school, early high school, and I was being asked to explain Islam and Muslims around the world to my peers and to educators. So that was the environment we lived in. And our founders, who were, some of them were educators, professors, researchers, and some were doctors, came together and said, we need to create this organization that will, bring the expertise and create the expertise that will speak on American Muslim issues from a research perspective. So, in our goal, as I mentioned, is to build that bridge between Muslims and non-Muslims and Muslims in the larger society, because we are part of a larger society. Highlight not only our contributions to the society from the get-go until now, but also how the society challenges this minority community. At the same time, we want to focus internally as well. So, we'll be talking later about how some of our research is focused on the American Muslim community internally. It's, its capacity, its challenges, the things that need to be addressed within Muslim institutions like weekend schools, mosques, family-related issues. So our research is looking at it from two lenses. And then the objective in solution seeking, like I said, a lot of people could easily identify problems. We're a community that could easily talk about, we have issue number 1, 2, 3, 4. And then people stop at that. So our goal is not to only do that, but to provide recommendations. We talk about Islamophobia. What can you do about Islamophobia? Because we want people to move beyond just talking about the problems, but to start addressing them.
Absolutely. And definitely one important way to do so is to open some constructive and well-informed dialogue and also to inform decision-making, wise and reasonable and balanced decision making, which is, of course, based in this case on objective research rather than on misconceptions and stereotypes and myths, as we're going to be talking about that in a minute. I'm really intrigued by your own title, Outreach and Partnership Manager. That really caught my attention. So if you can just help our listeners and viewers understand exactly what does that mean, like shortly or briefly, what does that particular title really mean and what does your particular job or role entail?
Yes, thank you. So outreach and partnership. So outreach, my role is, I'm part of the research team in our organization. I'm not a researcher. That's not my background. But what I do is I manage some of the research projects. So currently I'm managing a couple of the research projects. But really my role is to take all of our research that we have done and we're continuing to do and get it out to the public and to the different professional groups that we focus on. So we focus on policymakers, again, because we're trying to make well-informed decision-making process in this country. So policymakers, because, they make policies about American Muslims. So we want that, segment to be informed. So I get our work out to policymakers. I work with our communication team to get out to journalists and media professionals, educators, religious leaders and imams. So the different change makers or leaders in our society. My job is to get our research out to them, as well as to the general public. And then the partnership part is ISPU relies heavily on partnerships in getting our work not only done, but also to get it out. So we have a huge network of scholars. We have 60 scholars from around the country that are experts in their own fields, and they're affiliated with us. So I manage that network. And I also build relationships and partnerships with organizations or with scholars who either do similar work to what we do or are allies or will benefit from our work. So just like as a quick example, when we have a research project or a research event, we want to get as many people who are involved or who are part of that network. We want to get as many of them on the table as possible. So my role is to connect with them, build those relationships, and so forth.
Excellent. I know that ISPU has been conducting surveys annually in order to measure public opinion that's related to American Muslims in particular and to detect the most important changes and trends in public opinion on American Muslims. Can you briefly give us some highlights as to the most important continuous or consistent as well as changing and shifting trends that really kind of emerged from this kind of annual surveys over the last few years?
Yes, so you're talking about our American Muslim poll, which we just wrapped up the 5th year of American Muslim poll. Our next one will be in 2022. This is a huge project that we used to go annually. Now we have moved to every other year just because of the wealth of data and information that we get from that poll, that we literally need a full year to go through it and get it out to the public. So that poll, and what's really unique about ISPU is it measures the general public attitudes about different things. Everything from community-related issues like divorce, marriage, disability, drug abuse, to pluralistic issues like civic engagement, Islamophobia, philanthropy, and other things. The unique part about it is it doesn't only tell you how Muslims think about it. It tells you how the whole general public think about those issues. Then you could look and compare how the general public, how Muslims, how Jewish Americans, Christians, including Catholics, Protestants, and white evangelicals, and then even non-affiliates. So you could look at the exact same topic and look at how different faith communities view that exact same topic, which I think is a really powerful tool, not only for Muslims, but for everyone, because for a very long time, Islam and Muslims have been presented as so different and so unlike other faith communities. So now you could look at the research and say, well, this is how they compare to other faith communities. So that's one of the unique things about American Muslim poll. And I mentioned some of the topics that we have talked about, both focus on the community. And when I say community, I'm talking about American Muslim community, and then focus on the larger society. One of the major things that we have been testing with American Muslim poll is civic engagement. I'll just give an example of civic engagement because I know there's elections happening in so many communities, including in heavily Muslim or Arab American communities. So civic engagement and what it looks like inside the American Muslim community. And we started doing this in 2016. And our finding is Muslims continue to make gains in voter registration. So when we started in 2016, only 60% of American Muslims who were eligible to vote were registered to vote. That's extremely lower than any other faith community. And so that data point inspired a lot of civic engagement organizations, a lot of leaders in our communities to really push to get out the vote, get out registrations. A lot of programs that you see were kind of inspired by that data point. And then in 2020, we have 78% of those who were eligible to vote were registered to vote. So that's a huge change for the Muslim community. It's a huge win. It's a success that could be celebrated. Unfortunately, it is still lower than other faith communities. So that's one thing that we still need to address. The other finding is that outside or beyond voting and voter registrations, Muslims are actually either on par or exceed the general public in other civic engagement activities beyond voting. So they're more likely to attend town hall meetings. They're more likely to either volunteer or contribute to political campaigns, which tells us, and of course now we see a huge group of American Muslims who actually run for office. So you will see that civic engagement is healthier in American Muslim community than where it used to be, let's say 5 years ago.
Great, very interesting and very important findings. I'm sure we're going to be talking more about some of the issues in the rest of our discussion, but right now we're going to go for a commercial break. Stay tuned, please.
While we've been staying safe at home, scientists have been on a journey. The destination, a COVID-19 vaccine. This journey began decades ago with research into other coronaviruses. Scientists built from there with months of research and development, cooperation with other experts worldwide, and clinical trials on tens of thousands of volunteers of diverse race, age, and health status. They arrived at a safe, effective vaccine, and hundreds of thousands in Michigan have already been vaccinated. But the next step is ours. We need to get the vaccine when we can. Keep wearing masks correctly and taking precautions until we reach our destination, freedom from COVID-19 and getting back to the lives we love. Discover the facts for yourself at michigan.gov/COVID vaccine. A message from the Michigan Department of Health and Human Services.
Ziyad brand. Quality products from our family to yours. Ziyad Brothers Importing offers the finest quality products, including brands like Sultan, Kraft, Nestle, Hook, Rico Picon, Donna, and many more. Ask your retailer to carry these fine products because you deserve the very best. For more information, visit our website at www.ziyad.com. That's www.ziyad.com. Ziyad, quality products from our family to yours.
New Dawn Academy provides your kids with a curriculum that's rich in science, technology, engineering, and math.
We want students to really experience what problem solving looks like. What does it mean to build things together? And really working on those analytical skills is what makes New Dawn Academy's program very unique.
This school will certainly provide them with academic excellence, but also state-of-the-art buildings and inviting to students.
Get ready for an amazing experience at Ishtar Restaurant on 15 Mile Road in Sterling Heights. Enjoy excellent hospitality from owners Ali Al-Baghdadi and Fatty Bonham, serving the best in Mediterranean food. Try Chef Ali Al-Baghdadi's famous shawarma, the best Iraqi grills and food, and the best Arabic and international dishes. Dine in our authentic atmosphere or take out. Call 586-698-2585 or check us out on Facebook. Ishtar Restaurant practices all CDC guidelines and is open every day 11 a.m. to 10 p.m. Have an amazing experience today at Ishtar Restaurant, 3625 15 Mile Road, Sterling Heights.
This is Dr. Sahar Khamis. Welcome to my program, The Bridge, a monthly show bridging different cultures, communities, and faith traditions. Watch The Bridge on America's Voice of the Arabs Network on all social media platforms. Welcome back to the show, everyone. This is your host, Dr. Sahar Khamis, on the program The Bridge, airing live on Facebook and also on US Arab Radio. Today, we are discussing the many contributions and the challenges facing the American Muslim community. And with me this morning discussing this important and timely topic is an expert on this topic, Ms. Petra Alsoofy, who is the Outreach and Partnerships Manager at ISPU, the Institute for Social Policy and Understanding. Petra, we cannot talk about American Muslims without unfortunately talking about the concept or the notion of Islamophobia, which has definitely been having a great impact on this particular community, on Muslims, of course, worldwide, and American Muslims are no exception. If you can give us a little bit of an idea about some of the findings and the results from your own research, what have been some of the most important factors, maybe exacerbating or increasing Islamophobia, as well as possibly some of the factors that help to combat or to overcome Islamophobia based on the findings and research from ISPU?
Yes, thank you so much. And unfortunately, it's the truth that we do have to talk about Islamophobia. Before I get into some of the details, I want to highlight to the audience what we mean by Islamophobia when we say Islamophobia. Obviously, Islamophobia is just the fear of Islam or Muslims, the irrational fear of Islam and Muslims. And this is not a new concept. It's not something that just started suddenly 10 or 15 or even 5 years ago. This has been around us for longer than that. And it's rooted in the fact that there are just so many untruths and stereotypes about American Muslims. So one tool at ISPU, just to demonstrate to the audience what we mean, one tool that we developed with Bridgetown Initiative at Georgetown University is called the Islamophobia Index. We ask with the American Muslim poll, we ask the general audience, the general population, different religious groups, how much do you agree with the following statements? And I want people to listen to the statements that we ask, because pause and think about them. And then based on those statements did not just come, from our mind. Those are based on previous research that show people who actually believe these things are more likely to support policies that discriminate against American Muslims. They're more likely to support, they're very connected to authoritarian attitudes, which I'll talk about that a little bit. And they're also connected to discriminating against other minorities. So it's not, Islamophobia, it's not disconnected from other forms of racism and bigotry. We call it, it's a branch on the tree of bigotry. Okay, it's very connected to other forms of discrimination. So we ask people, how much do you agree with the following statements? And those statements are, most Muslims living in the United States are more prone to violence than others. So they're more likely to be violent than other people. How much do you agree that Muslims live in the US discriminate against women? That Muslims living in the US are hostile to the United States. Okay. That they hate the US and they want to harm it. How much do you agree that Muslims living in the US are less civilized than other people? Okay, less civilized. And then how much do you agree that Muslims living in the United States are partially responsible for acts of violence carried out by other Muslims. What we mean is some Muslim somewhere in Texas, Florida, pick your favorite state, did a really horrible thing. How much should you, Dr. Khamis, and myself, two people who have absolutely no connection to that person beyond that we share the same religion, how much should we be responsible for his or her actions? And unfortunately, what we saw is the agreement with these statements is actually growing over the last few years. The Islamophobia index is growing, it's increasing. The good news is we're not talking about the majority of Americans believe these things. We're not talking about 50% of the population say, yes to all these statements, but we are seeing an increase. So that's one thing. Like I mentioned, it's connected to other forms of bigotry. So another finding is that people who believe these statements actually, there are about 32 times as likely to also believe anti-Semitic attitudes. So it's very connected to other forms in anti-immigrant, anti-LGBT, and women's rights. Also, as I mentioned, people who believe these things, they're more likely to support policies that limits American Muslim freedoms, including support in surveilling them, including support of the Muslim ban, which impacted many people, restriction of building of mosques, and actually even restricting of the ability for American Muslims to vote. A basic democratic tendency. The last thing I want to say is Islamophobia. And I said it's connected to authoritarian attitudes. So there are people who are directly impacted by Islamophobia because they either have been impacted by a policy or they have faced discrimination. But the other piece is it really connected to authoritarian attitudes. So people who support Islamophobic beliefs, they're also more likely to support limiting freedom of the press, suspending our checks and balances, which that's what our American democracy stands on, but they're willing to kind of suspend it for a while for security reasons. And they're also more likely to support attacks against civilians, which is a crime under the war crime under the Geneva Convention. And then the last piece I want to add here is Muslims are not immune to Islamophobia. We as Muslims have internalized Islamophobia. So when we measure, I mentioned earlier that we look at different faith groups and how they measure on the Islamophobia index. Muslims are not measuring zero. Actually, the Jewish community have been able to reduce the level of Islamophobia among Jewish Americans over the last few years, and now they're lower in the Islamophobia index than American Muslims themselves. So we have internalized Islamophobia because we consume or we're receiving that information from the same source that other people are receiving it.
Absolutely. And before we talk about the source, especially the media in this case, I want to really highlight this very important point that Islamophobia is just part and parcel of this wider umbrella, unfortunately, of negative attitudes towards others, racism, discrimination, racism against Black people, against minorities, against Asians, against LGBTQ community, against immigrants, right? Anti-Semitism, all of these are part and parcel of the wider problem of hatred and discrimination. And Islamophobia is just one branch of this tree, unfortunately, just like you explained right now. As a professor of communication, I cannot help but ask, of course, the question about the role of the media in all of that. It is no secret that a lot of the misperceptions and stereotypes about Islam and Muslims are unfortunately fed by a lot of the media intake, a lot of the misrepresentations in the media, and ISPU is not turning a blind eye to this issue. I know that you have been engaging in media training for journalists and media people in order to do better reporting on Islam and Muslims. Can you talk a little bit about this particular aspect and what does this form of training and engagement with media and journalists entail?
Yes. Yeah, so thank you for bringing that up. So to start off, research showed that actually the media have showed and presented Islam and Muslims over the last 20 years worse than they have shown cancer and cocaine. Okay. And then the other fact that our research show is less than half of Americans know a Muslim in real life. Okay, because at the end of the day, we're only 1% of the population. So it's impossible for us to make ourselves known to every American, which is one of the factors that kind of reduce Islamophobia. Knowing a Muslim reduces Islamophobia. The question is, where do people get their information about American Muslims? From the media. The media, that's the source of information. And if the media is showing us as worse than cancer and cocaine, this is the kind of information they're consuming. Another piece that our research shows, so we did research on ideologically motivated violence. Okay, so, another word, terrorism. And we looked at the religious identity of those who commit those acts and how it played a role in how the media covers them. We looked at the exact same act, and if the act is committed by a Muslim, they are receiving 770% more media coverage than a non-Muslim who did the exact same thing. So not only are we worse than cancer and cocaine, people don't know Muslims in real life, but all they're consuming is very, very, very harmful and negative coverage. Okay, so what we do is we conduct media training. We have a toolkit on our website, ISPU.org, that's dedicated to journalists that pulls together all of the facts and information that journalists need to cover the American Muslim community factually and properly. We have it in one place for them. And then what we do is we actually contact media rooms, journalists, either, just because, or after, unfortunately, they have had a bad coverage or a story of a bad story. And we conduct training with them. We actually have a couple coming up this year. So what we do is we present the actual facts about the community. So now they have the facts and they could use them in their stories. But we also walk them through best practices of covering stories on American Muslims. So to give you an example, if a journalist is covering a domestic violence story or a story related to domestic violence, does the religious belief of the person who committed the violence or the victim, does it matter in that story? So we walk them through how they would cover it for other faith communities. And then we say, okay, well, here's how you're covering it for American Muslims. Here are the best practices. We also call on Muslims we ask them to call on Muslims to speak on non-Muslim related issues. So as you know, we have Muslims who are doctors, engineers, politicians. Don't call a Muslim to only talk about Muslim related issues. Call them to talk about health related issues if they're doctors. Call them to talk about education if they're in the education field. So we give them best practices and tools that help them do better when they're covering stories.
This is very important. And as we're talking about misperceptions and about stereotypes, I cannot help but ask specifically about American Muslim women. It is no secret that Muslim women in general and Muslim American women are no exception. Oftentimes they really get the worst misperceptions, as being, maybe humble and repressed and suppressed and submissive and not able to have some agency of their own. Briefly, before we go to the commercial break, how does ISPU research help to dispel some of the myths and some of the misconceptions about American Muslim women and Muslim women in general?
Good question. So for American Muslim women, as you know, they're on the worst receiving end of all the problems. So I talked earlier about the Islamophobia index, in that the belief that American Muslims are misogynistic. That's actually the most spread or widespread misbelief about American Muslims. Okay. And we asked about American Muslims. Do you think you're being discriminated in your own community or outside of your own community? And yes, there is discrimination, but American Muslim women do not see their faith as a source of discrimination. Matter of fact, they believe that Islam is their source of happiness and it brings them joy. And another piece very quickly is, so another word, we compile data about American Muslim women. They're more educated than actually Muslim men. They have higher incomes. They're in all kind of fields. There are issues that impact them. But one thing that I want to highlight very quickly is we looked at gender, racial, and religious discrimination. And gender discrimination, women in the Muslim community and in the general public, they're experiencing it at the same level, about 50%. So you're being discriminated against because you're a woman, period. But Muslim women are 75% of Muslim women are experiencing racial discrimination compared to 40% in the general public. And then finally, 69% of Muslim women experience religious discrimination compared to 26% in the general public. What that means is if you're an American Muslim woman who happen to be Black, you are receiving the worst kind of discrimination from everyone than if you were not. So gender discrimination is real, but more importantly, racial and religious discrimination impact Muslim women more than women in the general public.
Not to mention, of course, the element of the visibility, right? For women who are hijabi women who wear the hijab like yourself and like myself, more likely to also be discriminated against and to face incidents of Islamophobia and hatred and so on because of the visibility of their religious identity. Okay, we'll come back to this very important and interesting discussion right after this commercial break. Stay tuned, please.
Now getting your COVID-19 shot gives you a shot to win. Anyone in Michigan 18 and older vaccinated between December 1st, 2020 and July 30th, 2021 is now eligible to win millions in cash prizes, including $1 million jackpots and $50,000 daily prizes. And vaccinated students could win thousands in college scholarships. Get eligibility details and enter at mishottowin.com. Subject to sweepstakes rules. Scholarships available for ages 12 to 17.
At Top Rehab Physical Therapy Clinic in Dearborn, we provide effective physical therapy sessions in order to limit pain and discomfort. Top Rehab provides physical therapy care for any diagnosis prescribed by a physician, and we regularly see and treat conditions such as stroke, TMJ, fibromyalgia, sciatica, joint pain, and more. We use a variety of pain management methods, including modalities, soft tissue mobilization, and therapeutic exercise. If you're in need of physical rehabilitation or physical therapy, get the highest quality health care at Top Rehab. Most insurance is accepted, and we're open Monday, Wednesday, and Friday 8 to 6, Tuesday and Thursday 8 to 5, and Saturday 10 till 2. Call for an appointment today at 313-846-0555. That's 313-846-0555. Choose Top Rehab Physical Therapy Clinic on Michigan Avenue in Dearborn. Life's too short to be in pain.
Imagine you're on a train track. Somewhere miles away, a train is headed your way. You can't see it yet, but it's coming. Slowly but surely. If you have prediabetes or you're at risk for type 2 diabetes, you may be on the wrong track, and diabetes could be heading your way. Bit by bit, the danger is getting closer and closer. So should you stay on the track you're on now or move to make a change and reduce your risk? If you have prediabetes or you're at risk for type 2 diabetes, you may qualify for the National Diabetes Prevention Program in your local community. This one-year program could be the ongoing support you need to put you on the right track. Not only did participants lose weight, they cut their risk of type 2 diabetes in half. Ready to get on board for a healthier future? Learn more about the National Diabetes Prevention Program and what else you can do to manage and prevent diabetes at michigan.gov/diabetes. A message from the Michigan Department of Health and Human Services.
Are your hands feeling numb? Do you feel pain opening up a jar, turning a key? Are you noticing that your elbow and your shoulder are becoming stiff? Or were you recently injured in your arm? Hello, I'm Dr. Al-Majid Katranji, and at the Katranji Hand Center, which just recently opened down the street from the Somerset Mall, we can provide you with the latest in hand, wrist, elbow, and shoulder care. Visit us at www.katranjihandcenter.com to learn the latest techniques that we have to offer you, and I look forward to taking care of you.
Visit us in Troy at 1565 West Big Beaver Road, Building F, or call Katranji Hand Center for an appointment at 248-869-4263. That's 248-869-4263.
This is Dr. Sahar Khamis. Welcome to my program, The Bridge, a monthly show bridging different cultures, communities, and faith traditions. Watch The Bridge on America's Voice of the Arabs Network on all social media platforms. Welcome back back to the show, everyone. This is your host, Dr. Sahar Khamis, and we're talking today about the important contributions of American Muslims and the many challenges facing them as well. And with me this morning discussing this important topic is Ms. Petra Alsoofy, the Outreach and Partnerships Manager at ISPU. So we really want to move on to COVID-19, which had an impact, a huge impact on all communities. The American Muslim community is no exception, of course, but it has been also a double-edged sword in so many ways. What were some of the most negative impacts of COVID-19 on the American Muslim community based on the research which ISPU has conducted so far, as well as some of the opportunities maybe that were also allowed or given to the American Muslim community in terms of giving and contributing to society in the midst of this particular pandemic?
Thank you for this question. So very briefly, we have a couple projects on this, couple research projects on this topic that some of them are done and some you will see the results starting later this summer and fall and winter. So the first project that we have that we're actually analyzing the data right now talks about the mental health of Muslim healthcare workers. As you know, we have a huge percentage of American Muslims who are in the health field. Actually, if you look at the state of Michigan, where the Muslim population is less than 3%, but make up 15% of the medical doctors. So that's a huge number. So we're looking at the mental health of that segment of the population. We're hoping to have the results, in the early winter. The second one is looking at the impact of COVID-19 on just the general public. Again, American Muslims compared to other groups. And what we did is we collected stories of impact and of COVID-19 and also contributions. You could find this on our website. There is a map that shows the different way that American Muslims responded to COVID-19 nationally, but also you could look at your own state and see what organizations and individuals have done. In terms of the impact, we're finding, the initial finding is obviously impacted the mental health of American Muslim community. American Muslims are a third of that community actually are at or below the poverty line. And as we know, and 28% are African American Muslims. So we know, low income and also African American communities were heavily impacted by COVID-19 across the board. And as we know, this impacted the American Muslim community as well. The other piece is just the frontline workers. So we mentioned people in the medical field, or those like even in New York, 40% who are cab drivers are Muslims. So those at the front line were heavily impacted either by the disease itself, or through losing jobs, or their mental health issues. So we're still analyzing the data, and we're going to be releasing it over the next couple weeks and throughout the fall. That will include views on vaccine, views on wearing the mask, impact on job and relationships, as well as how they contributed. And then the last piece I want to mention is in terms of contributions. Even though COVID-19 impacted American Muslims heavily across the board, it did not stop them from, answering the call and, contributing in their communities in any way they can, from making masks to, volunteering their time, to donating money to the research of finding a cure for this disease, and so forth.
And that really takes me to my next question, which is about American Muslim philanthropy. Maybe the term philanthropy is not familiar to everyone. Philanthropy meaning the act of charity and giving, but it also takes so many different forms. It's not just about giving money, but you can also contribute so many other things like your time, and you can volunteer and so on. So can you just shed some light on the different forms of American Muslim philanthropy before, during, and after the COVID-19 pandemic?
Yes, so we have a full report on American Muslim philanthropy that people could access and look at the exact details. But just to quickly summarize, American Muslim philanthropy and giving, the research show it's inspired by their faith. We have the concept of zakat and sadaqah in Islam, so that this is really what drives people to give. 17% of those who were given said they're doing it because of their religious duty or religious obligation. And then 20% said they were given because they believe that, yeah, you should always give to those who have less than you do. Another finding is that Muslims give equally both within the American Muslim community and outside of the Muslim community. So our philanthropy is not restricted to just the Muslim American community. Just like other faith communities, this is an interesting finding. Muslims were given to their places of worship, to the mosque, at the same rate as other faith communities. It is the number one cause that people give to, given to building mosques and sustaining the mosque. But that's the number one cause, but it's not different than other faith communities. Beyond given to places of worship, elevating domestic poverty. Elevating poverty was the number one cause that people were given in the Muslim community were given to. And it was actually higher than other faith communities. So 81% of American Muslims were given to elevating poverty causes compared to between 50 and 70% among other faith communities. I think there's a belief in the American Muslim community that all the giving goes overseas. And one, that's not true. A lot of it is focused here domestically. But when it comes to overseas relief, actually white evangelicals surpass Muslims. So they gave more to overseas relief than Muslims did. So those are some of the findings. And then the last piece is Muslims were actually more likely to give to civil rights organizations than other faith communities. And I think that highlights a really important point, just how much civil rights causes really impact American Muslims and how it really shaped the way they think about the society.
Yeah, and I think part of the findings also has been that the amount of giving that they give to the particular places of worship or the mosques, the masjid, is pretty much similar or on par with the other faith groups in terms of giving to churches and synagogues. It's pretty much similar in that regard. And I'm also intrigued by the fact that it's not only about giving money, as I said, but also services and volunteering their time and helping in so many other ways, which is very interesting.
And we saw that. Sorry to interrupt. We saw that a lot during the COVID-19 for the COVID-19 research. So if you look on the map on our website, ISPU.org, and you look at the map and the different types of contributing that American Muslims did, it's everything from volunteering, giving their time, volunteering their expertise and services, to actually, donating money.
Excellent. I know that ISPU just released recently a study or a research on mosques, American mosques, which is very interesting. There is part 1 and there is part 2 of the study of American mosques. Can you just sum up briefly for us before we go to a commercial break, some of the most important highlights or some of the most important findings that came out of this particular research on American Muslim mosques?
Yes, so this project or this research have been going on for 30 years now. This is the third cycle of this research, and it's done with collaboration of a group that does the exact same research on American churches and synagogues. So you'll be able to see the data, compare it to other places of worship. So some of the interesting findings, the first report looked at the characteristics of the mosque. Are they growing, the number of mosques, what does the leadership look like, the locations, and so forth. The second report, which we literally just released yesterday, looks at the function of the mosque, who's participating, how women participation in the mosque look like, does it involve in civic life, is there's a divider between the men and the women section, and things like that. One very important finding that I think is relevant to your audience is young adults, so 18 to 34 years old, American Muslims continue to attend the mosque more than their peers are attending churches. Okay. However, the mosque is still not doing enough to attract that age group. So while they're attending more than people are attending churches, we're still not seeing a large enough number of them attending the mosque regularly. And then the second finding is that mosques continue to grow. We're seeing more mosques in more places, but we're also seeing more worshipers attending mosques. Okay. So those are a couple of the findings. And then the last one is that we continue to see imams becoming full-time imams as opposed to part-time or contractor, and more American-born imams are leading our mosques.
Very interesting findings. I know that there's also the parallel phenomena of being unmosqued, which basically that there are some people who do not attend the mosque, or young people who are not attending, or women who are discouraged to go. That maybe can be the seed for another ISPU study sometime soon. We'll come back to this interesting discussion right after this commercial break. Stay tuned, please.
Enjoy the first Syrian-style cuisine in Michigan. At Damas Cuisine and Catering, you'll find a wide selection of Syrian foods and sweets in our menu, like free cake, hoisin, grape leaves with steak, mishawi platter, hot mahashi, char-grilled kebab, shawarma, and much more. Get super fast delivery from Damas Cuisine and Catering right to your door. Order online at damascuisine.com/menu and track your order live. Damas Cuisine and Catering, 28841 Orchard Lake Road in Farmington Hills. Call 248-987-4985. Life is a nonprofit charity that's provided humanitarian aid and development to people and communities for over 25 years, regardless of race, color, religion, or cultural background. When disaster occurs here or around the world, Life for Relief and Development rushes in to provide food, medical aid, and shelter to those in need. Please help improve these efforts. Make your tax-deductible donation to Life now at lifeusa.org or call 248-424-7493. When it comes to reproductive medicine, IVF Michigan Fertility Centers are the recognized leaders. With locations in Bloomfield Hills and 5 other cities in Michigan and Ohio, IVF has experts in all aspects of the field. As a founding member of IVF Michigan Fertility Centers, Dr. Nicholas Shama is one of the leading reproductive endocrinologists in Michigan and Ohio. Dr. Shama has performed over 10,000 IVF cases and has helped thousands of couples fulfill their dreams of parenthood. American board certified in both obstetrics and gynecology and reproductive endocrinology and infertility, Dr. Nicholas Shama is a very caring, compassionate, expert physician that understands not only the medical but also the emotional toil of infertility on his patients. When it's time, get personalized care from Dr. Nicholas Shama at IVF Michigan Fertility Centers in Michigan and Ohio. Call toll-free 855-952-9600, 855-952-9600.
This is Dr. Sahar Khamis. Welcome to my program, The Bridge, a monthly show bridging different cultures, communities, and faith traditions. Watch The Bridge on America's Voice of the Arabs Network on all social media platforms. Welcome back to the show, everyone. This is your host, Dr. Sahar Khamis, and we're talking this morning about the American Muslim community, its most important contributions, and some of the challenges facing it. And with me this morning is Ms. Petra Alsoofy, who is the Outreach and Partnerships Manager at ISPU, Institute for Social Policy and Understanding. Petra, in the few remaining minutes in the program, I want to ask you quickly about the importance of interfaith work and interfaith outreach, right? Obviously, many of the problems we talked about involve not only American Muslims, but they also involve other communities. And I've seen in ISPU research, some of the findings say that when you know at least one American Muslim, that really does make a difference. And I've also seen that, for example, the Jewish American community has the least misperceptions or misconceptions about American Muslims. So this is very interesting. Can you very quickly tell us the importance of this type of interfaith work and solidarity, please?
Yes. So our research showed that, interfaith work is great, but we need to go a little bit beyond interfaith to more of an understanding. Just a quick example is in the area of education. Our research showed that 50% of American Muslim families say they have their kids in public education experience religious-based bullying. Okay. And 1 out of those 3 cases is at the hand of a teacher or an administrator. So it's very shocking to see these results. But believe it or not, it's still hard to go to a school district and say, here's what you need to teach about American Muslims and Islam. However, we know that the Sikh community and the Jewish community experience similar phenomena. So What we do is we work with the Sikh community and the Jewish communities, and you build allyship and you build understanding and you develop work together where you can easily take it to, for example, the school and say, here is how you could actually approach those through communities. So this is just an example of where discrimination and challenges faced by one religious communities actually impact in other communities, and how you could build allyship and work together.
Absolutely. These are very important points indeed, especially that we have shared challenges, and therefore the alliance and the solidarity is very important in this particular domain or this particular aspect. And my last question to you, Petra, is about some of the future research projects. You know, ISPU has done a lot of very interesting and important and useful research, but I'm sure you have a lot still to unpack and many other issues that you need to tackle. So can you just give our listeners and viewers, please, a brief idea about some of the future, maybe projects envisioned by ISPU moving forward?
Yes, so we have a long list of research projects that we're either working on or hoping to work on. Before I mention some of them, we talked a little bit earlier about the masked and the unmasked phenomena. And we actually do have research and recommendations for the community how to address that. So our Reimagining Muslim Spaces section of our research talk about how the mosque could be better welcoming to the youth, to women, to African-American communities, and so forth. So that's already there. It's on our website. I'm happy to share it with people. In terms of what's happening in a new research project, so I mentioned the 2 COVID-19 projects that we're working on right now: mental health of Muslim healthcare workers, impact of COVID-19 American Muslims. We have other research related to how Islamophobia looks like in certain specific either racial or religious communities that showed higher level of Islamophobia. So that's in the work. We actually will be launching a project soon that will look at the Native American Muslim experience, which we're super excited about that one. But we also have many pieces coming out about drug addiction, disability in the American Muslim community, and so much more. We literally have a whole list of research. We just need to find some of the funding for it.
This is very interesting and very important. I think also the indigenous, Muslims and indigenous community. This is a very important topic to address, and definitely mental health issues as well. I know for sure that also ISPU has some special interest in the area of addressing mental health issues in the American Muslim community. Can you very briefly just give us an idea quickly about this particular project? Have you already started this? Some of the maybe indicators moving forward, like less than half a minute.
Yes, so very briefly, if you go to ispu.org and you look at resource education and resources, you will find toolkits. We have a full toolkit that looks at mental health related research and recommendations in a directory of mental health professionals who are Muslim.
Excellent. I'm sure there is much more to unpack, but I'm afraid we're also running out of time. Good times always fly quickly. So this has been a very interesting and very insightful discussion. Thank you so much, Petra, for accepting the invitation and coming on the show. And I'm sure we're going to have you back again on the show at some point to talk about more research, more interesting objective research, which is being done by ISPU. Thank you.
Thank you so much for having me.
Thank you. And thanks to all our listeners and viewers everywhere on Facebook, on US Arab Radio. Take care, stay blessed, and have a good day. Thank you and goodbye.